Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Transcatheter Aortic Valve Replacement, TAVR. Introduction. Aortic stenosis is one of the most common heart valve diseases. Left untreated, severe cases of aortic stenosis can lead to death. Transcatheter aortic valve replacement, or TAVR, is a procedure to treat aortic stenosis. TAVR can be life-saving and can improve fatigue, shortness of breath, and overall quality of life. This program explains aortic stenosis and its treatment options. It discusses the risks and complications of TAVR. It also explains what happens before, during, and after the procedure. Aortic stenosis. The aorta is the largest artery in the body. The aortic valve lets blood flow from the heart to the aorta. Each time the heart beats, blood flows through the aortic valve to the rest of the body. The valve does not allow blood to flow back into the heart. Aortic stenosis happens when the aortic valve narrows and cannot fully open. This makes it harder for the heart to pump blood to the body. Symptoms of aortic stenosis include chest pain, fainting, fatigue or weakness, shortness of breath, and irregular heartbeat. Alternative treatments. Sometimes aortic stenosis does not need treatment. Medications may be used to help strengthen the heart and delay the need for a procedure like TAVR. Exercising and losing weight may help strengthen your heart. Ask your healthcare provider to help you create an exercise and eating plan that is right for you. Other patients may require a procedure to repair or replace the valve. Healthcare providers usually recommend open heart surgery for people with severe aortic stenosis. TAVR is an option for people who cannot have open heart surgery because of old age or other medical problems. In general, younger and healthier patients can have open heart surgery. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Before the procedure. You will have a physical examination before the procedure. You may have several tests performed. These may include an angiogram, an echocardiogram or echo, an electrocardiogram or ECG, carotid Doppler ultrasound, CT scan, blood tests, and other tests. Your healthcare provider will review the test results and see if you are a candidate for TAVR. Tell your healthcare provider about any health conditions or allergies you have. Also, tell him or her about any supplements and prescription or over-the-counter medications you are taking. Smoking damages the heart and delays healing after surgery. If you smoke, quit before the surgery. Talk with your healthcare provider if you need help quitting. Your healthcare provider will tell you how to prepare for TAVR. He or she may tell you to stop taking certain medications to help prevent complications such as bleeding. Complete any final tests the day before. Not eat or drink for a certain number of hours before the procedure. Shower with special soap once or more. The procedure. You will receive general anesthesia or local sedation. Having general anesthesia means you will not be awake for the procedure. You will not feel the procedure or remember it when you wake up. Local sedation means you will not feel pain during the procedure, but you will be awake. Your doctor may give you medication to help you relax. The procedure may take 2 to 4 hours. A team of healthcare providers will work together to monitor you during the procedure. A healthcare provider will make one or more small incisions or cuts in the groin or other places on the body. He or she will insert a long and thin plastic tube called a catheter into an artery in the groin, neck, or chest. Your aortic valve will be replaced by a valve made of animal tissue held inside a device called a stent. A healthcare provider will fold the valve and take it through the catheter all the way to the heart. When the catheter reaches your aortic valve, the new valve will be positioned and opened. In some cases, a balloon will be used to press the flaps of the old valve against the wall of the aorta. A healthcare provider will remove the catheter and close the incisions to stop bleeding. The new valve will stay permanently over top of the old valve. The new valve will start working right away. Risks and complications. The TAVR procedure is relatively safe. There are possible risks and complications. These are not likely. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. All procedures or surgeries carry the risk of infection or a reaction to anesthesia. Most healthy people do not have any problems with anesthesia. Some people have mild and temporary symptoms, but anesthesia is safe. Risks of anesthesia include the possibility of cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. Other serious risks of anesthesia may include heart attack, lung infection, stroke. Your healthcare provider will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they can cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you have symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery and walking may help decrease the risk of blood clots. Other risks are seen in any type of surgery. These include 1. Infection. Infection may be at the skin level or deeper in the tissue. Treating deep infections may require long-term antibiotics and surgery. 2. Bleeding, either during or after the operation. 3. A skin scar that could be painful or unsightly. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Rarely, TAVR can lead to complications such as a leaking heart valve, heart damage, or stroke. Other risks of TAVR include bleeding from the incisions and slow heartbeats. You might need a pacemaker to correct the heartbeat after TAVR. In rare cases, you may need emergency surgery after TAVR. After the procedure, your healthcare provider may ask that you stay in bed for up to 6 hours after TAVR. Most people stay in the healthcare facility 2 to 3 days after the procedure. Ask your healthcare provider when you can remove the dressings on your groin after the procedure. If the puncture site has liquid coming from it, put a Band-Aid on. You may also notice a small lump or bruise. This will disappear in 2 to 4 weeks. You may feel tenderness or discomfort where the catheter was inserted. If the pain gets worse or the lump or bruise gets bigger, call your healthcare provider or go to the nearest emergency room. In rare cases, the puncture site may start bleeding. If this happens, go to the emergency room so you don't lose too much blood. While you wait, lay down and apply firm pressure 1 centimeter above the puncture site. You may feel weak or tired after the procedure, but it is important for you to get out of bed and walk. This helps prevent fluid buildup in the lungs. When you sit, prop your legs up to help prevent blood clots from forming. Slowly increase your daily activities after the procedure. Avoid driving, lifting anything heavier than 10 pounds, 5 kilograms, and activities like bending and squatting for the first week. Deep breathing exercises can help prevent lung infections. To do deep breathing exercises, hold a deep breath for as long as possible. Cough strongly when you breathe out. This can help open your airways. Weigh yourself first thing in the morning after you go to the bathroom, but before you eat breakfast. Weigh yourself every morning and write down your weight in a journal. If you are gaining weight or have swollen ankles, contact your healthcare provider right away. You may need to take a blood thinner after TAVR. Ask your healthcare provider for how long you should take the blood thinner. If you are taking warfarin, Coumadin, you will need regular blood work to measure how thin your blood is. The nurses may give you a card to keep in your wallet to notify healthcare providers that you have had a heart valve replacement. This can affect your treatment options. Show this card to your dentist and all other healthcare providers before you receive medical care. You may need to take antibiotics before future dental procedures. Take care of your teeth and mouth by brushing and flossing every day. This can help prevent a heart infection. Your healthcare provider may recommend a cardiac rehabilitation program after TAVR. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Certain diseases and conditions can make it hard for the aortic valve to open and close. This is called aortic stenosis. Transcatheter aortic valve replacement, or TAVR, is a procedure to replace an aortic valve that does not work properly. TAVR is done through one or more small incisions in the body. Your aortic valve will be replaced by a valve made of animal tissue held inside a device called a stent. You will receive general anesthesia or local sedation. Having general anesthesia means you will not be awake for the procedure. Local sedation means you will not feel pain during the procedure, but you will be awake. TAVR is relatively safe. It can be life-saving and can improve fatigue, shortness of breath, and overall quality of life. Thank you for using Explain.